Steatorrhea. The definition of steatorrhea is the presence of excessive undigested fat in loose stools. Steatorrhea is one of the clinical features of fat malabsorption and is noted in many conditions such as exocrine pancreatic insufficiency, biliary obstruction and ileal resection. An increase in the fat content of stools results in the production of pale, large volume, malodorous, loose stools. Fat absorption requires bile acids, digestive enzymes, and a normally functioning small intestinal mucosa. Dietary lipids, mostly triacylglycerol, are initially emulsified by bile acids and then hydrolyzed by the pancreatic lipases and cholipases into free fatty acids and monoglycerides. In the proximal small bowel, these hydrolyzed lipids form micelles by the action of bile acids. The micelles are then absorbed across the intestinal villi and transported as chylomicrons via the intestinal lymphatics. Therefore, any defects in the availability or function of bile acids, pancreatic digestive enzymes, or absorptive villi will lead to steatorrhea. The causes of steatorrhea are numerous and subclassified under three broad categories: conditions leading to exocrine pancreatic insufficiency, bile acid deficiency states, diseases affecting the small intestine. The most notable disorders in each category are exocrine pancreatic insufficiency due to chronic pancreatitis, cystic fibrosis, and conditions resulting in pancreatic duct obstruction or resection of pancreas. Bile acid deficiency is either due to cholestasis, for example primary biliary cholangitis, primary sclerosing cholangitis, or inability to absorb bile acids in the distal ileum resulting in diminished bile acid pool, for example ileal resection, or Crohn's disease of the ileum or deconjugation of bile acids, for example, small intestinal bacterial overgrowth. Diseases affecting proximal small intestine such as celiac disease, tropical sprue, giardiasis, Whipple disease, lymphoma, amyloidosis, small intestinal bacterial overgrowth and HIV enteropathy. Other rare causes of steatorrhea include lipase inhibitors such as orlistat, Zollinger-Ellison syndrome, in which increased production of gastric acid inactivates the pH-sensitive pancreatic lipases, and graft versus host disease,